All right. So thanks for being here with us today. We're just going to go through and talk about this awesome partnership, excuse me, that we have between OSU Optometry and our OSU affiliated early Head Start programs. So we're so lucky that we've been able to connect, and also that we've been able to get some awesome funding through the Healthy Eyes, Healthy Children grant that has been sponsored by the Essilor Foundation through the Optometry Cares program. So we started this little partnership a number of years ago, but really got about a year ago came to fruition to be able to start seeing patients. And then lucky to get some funding to help continue it to provide care for our littlest ones. So today we're just going to talk about some early vision intervention and why that's really important for our Head Start kiddos. So kind of going through what we're going to talk about. We're going to talk about vision development periods. We're going to talk about amblyopia, and we'll talk about what that is. We're going to talk about eye diseases that might happen in kids that we would be looking for, the importance of eye exams, and also how that would relate to early literacy, which I know is something that we're all interested in. So when we think about vision development, we think about, when do these different components of vision start to develop? And so I don't know how many of you think about this regularly, but we often are told, when a baby's born that there isn't much vision or isn't much usable vision. And that's why we might try to stimulate their vision with really high contrast materials like black and white or bright colors, things like that. But the vision develops quite rapidly. And so you can see, I just have a table of some of the different things that with our vision. So like visual acuity, that's what we think of. We want 20/20 vision, or the ability to see really small details. So that becomes near adult-like by the first year of life. Contrast sensitivity, that's how different, can we see only a difference in black and white, or can we see shades of gray? Our eye teaming, our eye coordination, are our eyes aligned, and do they work together? That develops by 5 months. Our eye focusing, that's our ability to change our focus from distance to near. Can we clear that vision to be able to see up close? And our depth perception, man, that can be really important when we're trying to learn to walk and get through our different unfamiliar spaces. Even thinking of more fine motor things like cutting, right? As we're starting to use our hands more and learn to use scissors, things like that. Depth perception can be really important for activities like that. Our color vision, we start to learn our colors early on. And so, that ability becomes adult-like around 4 months. And then our eye movements, our ability to kind of track an object that maybe you're moving across their field of view. So that ability, again, by 6 months. So you can see between 6 and 12 months, our vision becomes very adult-like, even though maybe the rest of us is not adult-like at that point. But we're just, we want to make sure that it's developing appropriately and we're meeting these vision milestones because vision is so important as we're trying to learn. So we think about these different periods of visual development, and if something goes wrong with the visual system during these different periods, it's going to give you different outcomes. For example, the first period is the critical period, birth to 3 years old. And so if something happens or is present during this period, it's very, very visually devastating. So let's say you have something called a ptosis, where one eye is closed and that eye is not getting vision. If that ptosis or that visual deprivation was present during the critical period, that would cause major visual issues and reduced vision in that eye. The sensitive period is 3 to 10 years old. So if that ptosis occurred during that period, that eye droop occurred during that period, the damage would be less severe, because as you have this really rapid visual development in your first year of life, you had normal access to vision in both eyes. It wasn't until later that that eyelid drooped down. So we would have, you still could develop some reduction in your vision, but it wouldn't be as severe. And then once you get past about 10 years old, we call that the plastic period. So, you know, we can treat your vision at that point. We're not expecting your vision to get more reduced at that point, but we only would hope to improve your vision there. And so why is it important to mention these 3 periods? Well, this critical period, the most important period, you know, that's the ages of the kiddos in the early Head Start. And so if we can detect these problems during the critical period, we'll have the most success in treatment, and it will leave us with the best ultimate prognosis, because it is such an important period of visual development. So I kind of have been alluding to this reduced vision that our little kiddos might have, and it can be caused by something which we call amblyopia. And sometimes you'll hear this as lazy eye. So amblyopia basically means there's reduced vision and I can't just immediately correct it. So I can put a pair of glasses on, but it's not immediately going to make your vision better. It's going to take time. Or if my amblyopia was caused, like I said, from like a ptosis or a covering of one eye, we could have surgery to lift that eyelid up, but the vision's not immediately going to be perfect. It's going to take time. So amblyopia is caused by having one of these, what we call amblyogenic risk factors, that's present during that critical or sensitive period. And we're going to talk about what those factors are, because when we think of lazy eye, a lot of times we think of an eye that's drifted in or out. But really, you can have reduced vision or a lazy eye without having an eye that's turned. So it's not as obvious. You know, when we think about looking at, you know, subconsciously or not, when we look at someone, you know, you often will notice if their eyes don't look like they're pointed in the same direction. That's something that's more obvious to us. But the other things you won't be able to notice unless you did an eye exam. And that's why it's really important that we take care of these kiddos. So here's those amblyogenic risk factors that I was alluding to. The third one down there on the list, the constant unilateral strabismus, that's our fancy word for saying, hey, you always have an eye that's turned out, or you always have an eye that's turned in. It's constant. It only occurs in one eye. And strabismus is the term for an eye turn, okay? So that's the one that's more obvious. And when we have kids that come in for their eye exam, this is far and away the reason that they come in. Their parents think that they have an eye that has drifted in or out. The other ones are the things we can't see. So the first one, anisometropia, that's where you have a high prescription in one eye and not the other. Okay, so if I have a really high prescription in one eye and not the other, my brain's going to use this eye because it's easy to use that eye, and I'm just going to turn off the other eye. And once the brain turns off that eye, the vision is not developing normally. So my good eye just keeps getting better and better, and my eye with the high prescription just stays in the background. Okay, so in that case, we would want to be able to detect that so that we could fix that unequal prescription by giving a pair of glasses. Now both eyes have an equal, clear image going to the brain, so the brain can learn how to use both eyes together instead of turning one off. Our next there on the list is isoametropia. Isoametropia is when both eyes have a really high prescription. So in that case, the vision's just never clear to either eye. So that we also fix with glasses. We give a pair of glasses, again, to make both eyes have a clear image to get back to the brain. So the brain knows how to interpret it and use the eyes together. When we have a high prescription in both eyes, it's easier to treat than a high prescription in just one eye, because the prescription has been, or because the brain's been kind of deprived of clear vision in both eyes, it's super motivated to see. And so both eyes will progress and move forward to be able to see clearly. When we have just one eye where the prescription's higher, it's harder to motivate the brain to see with that other eye. So sometimes we have to do things like eye patches or other medications. And then the last one on the list, visual deprivation. This is what I was alluding to with the ptosis, or it could be a cataract, a congenital cataract that formed in that eye. So something where the visual axis, the light coming into the eye, that is just obstructed. And this is the hardest one to treat, just because it's almost always happens during the critical period. So a child is born with a cataract or a ptosis or something like that. And because they're missing out on that really good, important developmental time, it's just very visually devastating. Now, if the kid develops some sort of obstruction during the sensitive period, then it's not as bad, but it's much, much more common for it to occur right when they're born or within a few months of being born. All right, so amblyopia treatments, as I kind of was saying along the way, glasses is going to be our biggest treatment, giving clear vision to each eye. In the case where there's that unequal prescription, if the brain doesn't automatically over time start using the eyes together with glasses, sometimes we have to do eye patching. Occasionally we use eye drops to make the good eye blurry so that the brain starts using the weaker eye. And then in older kiddos, sometimes we can do vision therapy. Those are kind of like eye exercises where we train the brain to use the eyes together. But one of the things that I just think is really great outcome for doing these early exams is that if we can get glasses on the kid before they develop amblyopia, then we don't have to think about doing treatments like eye patching, which is very hard to get a little kid to wear an eye patch for a number of hours, as you guys can probably imagine, or doing an eye drop, putting a medication in the eye when we could have just completely prevented this from happening. So this is a cause near and dear to my heart. This is my little daughter, Violet. On the left there, you can see when she was a baby, we caught that she had a really high prescription in both eyes. So when she was an infant, her prescription was about plus 650. A normal prescription for an infant should be around plus 2. Okay, so she was a really high prescription. And we put her in glasses, and this is her when she's about 4, now she's 6. She has normal vision in both eyes. She has normal eye teaming, great depth perception, and she never developed an eye turn. A kid who is plus 650 is about 200 times more likely to develop an eye turn. She would have eventually. Her dad, my husband, has, when he takes his glasses off, his eye turns. So I know she had it coming for her, but ultimately, we didn't have to go through dealing with the eye turn or the patching or anything like that because we got her in the glasses before any of that developed. And so that's kind of what our goal is here, right? Can we detect these risk factors, get a kiddo in glasses if they need it, and then they won't have to deal with the kind of the aftermath of treating a condition that has already onset when we could prevent it to begin with. So you'll see I stole some of the slides that Healthy Eyes, Healthy Children had made. And so I just thought this one was really nice. If we can get early care for our kiddos, then we can prevent vision loss. Okay, so that's what I'm kind of preaching to you guys. The reason that we do early intervention for everything, right, is to prevent problems in the future. And vision's one of those things that often gets left behind, especially if a parent doesn't have an eye problem. They don't think about vision as being a potential problem for their kid. So if we can do these routine exams, we can find issues that we can make hopefully their future a little bit better. So those are all, good things that we're hoping to find and prevent. And that's really, when people talk about the importance of getting eye checks, they're really thinking about, preventing amblyopia in kids. But, what are other things we're looking for? Well, one of the things that we do is to put eye drops in the kids' eyes. One of the reasons we do that is to be able to find out fully what their glasses prescription would be. But another really important reason is because we need to make sure their eyes are healthy and developing normally. So I'm just going to go through a couple conditions here, which would be things that we would be looking for and want to detect, because they could give us a clue as to something else going on with the kid. So the first one is optic nerve hypoplasia. And so the optic nerve is what connects your eye to your brain. And so that's kind of the pathway that, all that the vision is going back and forth. And so when the optic nerve is hypoplastic, that means that the nerve did not develop normally. It doesn't have this normal number of nerve fibers going from the brain to the eye. And so the nerve is very, very small compared to what size it should be. And the reason that we want to detect this is it could cause reduced vision, but the vision could be normal. There's kind of a spectrum. But the big thing is, if this occurs, it could indicate that there's other things going on with the brain. So sometimes there's other midline defects in the brain. So if we would detect this would be something that we would recommend that the kid get an MRI for, because if other midline structures of the brain are affected, that would include some, things like the pituitary gland, and that could lead to things like growth problems. So there might be other developmental delays that could coincide with this condition. So it's just one of those things where, it's easy to look inside the eyes with a kid who's cooperative. It's easy to look inside and just check that out, and kind of check that off your list that the kid has a normal, healthy, developing optic nerve. Another thing that we look for in kids is to see that their blood vessels are developing normally. Sometimes we can have a condition called Coats disease where there's very leaky blood vessels. And these leaky blood vessels can cause damage to the eye. And one of the biggest things it can cause is a retinal detachment. So when you're looking at this picture here, the optic nerve is that little circle where all the blood vessels radiate out from. And then the yellow spots that are all over that picture, those aren't supposed to be there. That's all the leakage from the blood vessels. And so as that fluid just continues to build up, the retina, which is the inside lining of the eye, that can come detached. Once the retina is detached, you don't have vision there because the photoreceptors, which are what receives the light from the eye, they're unable to receive that to send it to the nerve and back to the brain. So with the retina detached, that's a very bad circumstance. Now it's something that can be reattached, but once it's surgically reattached, the visual prognosis isn't as great. So if we saw a kid that had leaky blood vessels, that's something we would refer to ophthalmology, a pediatric ophthalmologist, and they would take a look and potentially do some laser on the back of the eye to kind of pin down the retina so it would be less likely to be detached, right? So if we can prevent that detachment from ever occurring, then they're more likely to have a better visual outcome. All right. Another thing that we're looking for is, in the overall health of the retina is, do we see any blood that's outside of blood vessels? So just like in your body, right, you always want your blood to be in your blood vessels, not just pooling like a bruise or something like that, indicating that you got injured. So when there's blood outside of the blood vessels in the eye, it could be a number of things. In adults, it's likely to be something like diabetes or high blood pressure. Because infant through 3-year-olds are very unlikely to have diabetes or high blood pressure. One of the more common reasons that you could see that would be abuse. And so something that no one likes to consider or think about, right? But it's something that's really important to detect. So in a little one, if a little one is shaken, that can cause leaky blood vessels. And so if you look at kind of some of the statistics, when they looked at those that had blood in their retina who were younger than 2 years old, it's much more likely to be abuse than an accident, like where a kid fell down the stairs or something like that. So when we see blood in the eye, that's kind of where our brain goes to, and it's at least worth an investigation. So that's another thing that we would be looking for when we dilate the kid's eyes. And then the last one that I'm going to talk about here is another scary thing that we don't want to find, but it's really important to detect early, and that's a condition called retinoblastoma. So retinoblastoma is the most common childhood intraocular malignancy. So basically it's a cancer of the eye, and it typically develops in the very early childhood. And so it's most often detected by about 18 months. With this, the earlier you detect it, the more likely the kid is to be able to maintain good usable vision and not have to lose their eye. So in the early stages, if it's caught, they can do laser treatments. As it progresses more, they'll do different types of chemotherapy or radiation. And then it can get to the point where it's just taken over the eye and they have to take out the eye. But one of the other things that we want to make sure is that it actually hasn't metastasized or gone to another place in the body. And so the liver is often one of the first places that a retinoblastoma will go. So if a kid was diagnosed with this condition, they would also have a full body scan just to make sure that the cancer didn't go anywhere else. But if it's caught early, the survival rates are fantastic. Okay, so this is another reason why we want to check. And so sometimes people will see through different, they'll see an article online where someone had diagnosed or at least was suspicious of a child having something wrong with their eye because their pupil looked white. And so when you think about, if you take a picture, maybe now this doesn't happen as much because cameras filter out the red reflex that you would see in your pupil. But at least previously when you would take a picture, right, sometimes you would have where your eyes looked really goofy because you would see like red shining through your pupil. That would be good. We want red to be what's shining back. We want to have that red eye reflex. Sometimes when you take a picture or there's a light shining at the eye, instead of seeing red, which is your retina reflecting, you actually see white. And so if there was if you saw white, that could indicate that there was a cataract or something in the lens. There could be a retinal detachment in the back of the eye. It could be a tumor like retinoblastoma. So that is something that if you ever in anyone see a white pupil, you would want to let them know. And in this particular case, where I have the pictures here, this was an adorable 2-year-old named Katie. So my name, so I'll always remember her. But she had retinoblastoma in both eyes, and she was being treated at Mass Eye and Ear, and she was flying to Boston to get these treatments to try to save her eyes. Her parents didn't want her to lose both of her eyes and be completely blind. And so, this is something where if she had been caught earlier, that would have been a much better outcome. But you can see, looking at these pictures, all of those white clusters are all tumors that have really overtaken her eyes. And so again, it's just important to have these things checked early because we can help save some vision. Okay, So no more depressing eye pictures about why we're trying to drive home the point that it's important to check. But really thinking about, why are we doing this? How many kids have problems? Is it worth it going through an eye exam on someone who doesn't know what's going on, or who maybe isn't the most active participant in the exam? Look how many kiddos entering preschool have vision problems. 1 out of 5, and then entering into school, 1 out of 4. That's a huge percentage of kids. And when we learn in the classroom, it's actually like 70% of what we learn is presented visually. And so if you don't have normal vision going into that, you're at a huge disadvantage against your classmates to be able to learn at the same rate as they are. So let's go back here. So when do we recommend first eye exam? First eye exam we do between 6 and 12 months. So again, we want to see them during this critical period of visual development. Can we find any risk factors, or is there anything going on with the health of the eyes that we can prevent any future problems? If everything's normal during that exam, there's no risk factors, nothing going on, then we see them again at age 3, again, to make sure their vision's developing in the way we want. And then again at 5, as they're kind of entering into kindergarten. Once they're in school, we want to see them every year. Okay, we want to see how their vision's doing, how it's changing, make sure there's nothing that we can do that would make learning easier on them. We don't want their eyes or their vision to be a barrier to them learning. And so we recognize that it's important to actually have a comprehensive eye exam. Through schools, kids are provided with screenings, but a screening is just not going to catch everything, okay? Doing an exam without dilating a kid is really missing a huge amount. Besides the fact that you can't see into the back of the eye readily to catch these conditions that we're really concerned about, kids also do a fantastic job of really focusing their eyes and hiding prescriptions from us. And so sometimes we're going through the exam and we're like, oh yeah, things are looking pretty normal. And then we put in dilating drops and we're like, oh man, that kid has a high prescription. I can't believe he's trying to focus his eyes that much all day. He must be getting headaches or strain or things like that with his eyes. And if you can imagine trying to read, and every time you tried to read, you got a headache, do you think you're going to like to read? Probably not. And so it's one of those things that we can fix. We just have to know about it. All right, so this is another one of those slides that I borrowed from Healthy Eyes, Healthy Children, just to kind of drive home the point that I was just talking about. Screenings can miss up to 75% of vision problems. Okay, they're well intended, but they're really made just to detect more severe types of amblyopia. They don't detect minor problems that can still have a significant impact on learning. And then the worst part is, once you've done a screening and notified the family or guardian that the kid has failed a screening, most of the time it's never followed up on. So even if you detect a problem, it doesn't mean that the resolution is in sight. And I can remember this little girl just sticks out in my mind at a particular grade school that we went to, and we screened her in kindergarten, first grade, second grade, never got care, and then wasn't passing her third grade reading guarantee. And her prescription was about plus 13. And that was without us even putting in eye drops or anything. She couldn't see anything. And, it's just so heartbreaking because she doesn't have a chance, right? She can't see to read. So it's not that, getting her extra reading attention is going to help. She just needs a pair of glasses, and then she can start the process of learning to read. So it's all of those years that were lost because it was never followed up on. So that's one of the reasons that when we talked about this partnership initially, the word screening came up, and I was like, no, we're going to do better. We're going to do comprehensive exams for these kids because we don't want to screen and have something missed, or not have something followed up on, when we could just be better and do exams and get them the treatment that they need. So this kind of is piggybacking off of the stories that I've told, but this is just a really great study, and Dr. Culp, who's the lead author, is one of our researchers at the College of Optometry. And they looked at kids with different amounts of prescription, far-sighted prescription, and how that might affect their literacy as they're entering into school. And kids who had this moderate or high amount of farsightedness, or just had inability to make it clear, to focus their eyes to make it clear when they were looking up close, scored lower on the test of early preschool literacy. And so, you know, here we have actual data that if a kid has a vision problem that's not corrected, they're not going to enter with the same potential, that same literacy level as kiddos who were corrected or who didn't have that risk factor. So what are the barriers? You know, why doesn't everyone just get an eye exam? Okay. One of the biggest ones, and this is on us, is awareness, right? People don't realize that they need eye exams. They're not recommended routinely. And I think historically some of that was due to cost. Now, since the Affordable Care Act a number of years ago, an eye exam for kids under 18 was deemed to be an essential benefit. And so anyone who has insurance, 18 and under, has access to a comprehensive eye exam every year. So hopefully that message can get across, and cost is not the reason that kids aren't getting eye exams. But the other is just availability of care. So not everyone's in an area where they have access to a doctor who either feels comfortable seeing kids, or maybe they're just in a rural area where there's not a doctor around. And then not having the awareness that it's a necessary thing, they don't seek out that care. So we're lucky in Columbus that we have many providers, and we have the people who are trained and able and willing and love to see kids. And so we're trying to kind of break down some of those barriers to get access to these kids who, you know, have these risks for developing vision problems. Okay, so we made it through all the different areas I was hoping to touch on today. And then just to kind of leave you with the sentiment, again, we've worked hard for this partnership over many meetings and years. We're so thankful to have some extra funding to be able to provide glasses and exam equipment and different things like that have aided us in this journey. And ultimately, the result of that is we're providing comprehensive eye exams, not screenings, comprehensive eye exams, looking for those the refractive error, the high prescriptions that might need glasses. We're looking for risk factors that might cause amblyopia or lazy eye. And we're looking at the health of the eyes to look for any disease that might be present. So it's an awesome program, and we're so excited to get started again. Does anyone have any questions for me? All right. I am happy to, I should have put my email in there, but I'm happy to answer questions for everybody. My email is mcdaniel.547@osu.edu. So McDaniel.547. And I'm, like I said, happy to answer any questions about vision development, or what happens during an eye exam. Thank you.